A vaccine is a product that produces immunity from a disease and can be administered by needle injection, by mouth, or by aerosol. A vaccination is an injection of a killed or weakened organism that produces immunity in the body from that organism. An immunization is the process that someone undergoes to be protected from a disease. Immunizations are safe and effective. They work through our bodies to help prevent illness and disease outbreaks. And thanks to these vaccines, we've been able to eliminate some of these diseases in our community. Therefore, we must continue to vaccinate so that these diseases do not come back. It's also very important that children are up to date with their age-appropriate immunizations, as Louisiana law can require proof of immunization as children progress through school. All childhood vaccines are given in a series of 2 or more doses. Some of the most common vaccines and immunizations given to children are DTaP, protects against tetanus, diphtheria, and pertussis. Hib, protects against Haemophilus influenza type B. Varicella, protects against chickenpox. Hep A and Hep B protect against hepatitis A and B. MMR protects against measles, mumps, and rubella. IPV protects against polio. PCV protects against pneumococcus. RV protects against rotavirus. The single best way to protect against the flu is to receive the flu shot. Once children are ages 6 months old, they can receive their first immunization of the flu vaccine, and then they can continue to receive it annually after that. This disease spreads very easily, and each year millions of children and adults become sick with the flu. Some even get hospitalized due to flu-related illnesses. Although I do not treat patients under the age of 2, there are many immunizations that are administered to infants during this time in their life. It's really important to consult your children's pediatrician for an up-to-date immunization schedule. And for a comprehensive list, you can refer to the Center for Disease Control's website. But some of the routine immunizations for infants are as follows. At birth, hepatitis B. 2 months, hepatitis B, along with DTaP, PCV13, Hib, polio, and rotavirus. 4 months, DTaP, PCV13, Hib, polio, and rotavirus. 6 months, hepatitis B, DTaP, PCV13, Hib, polio, and rotavirus. 12 months, MMR, PCV13, Hib, varicella, plus hepatitis A. 15 months, DTaP. By following the recommended immunization schedule, by the time your children reach age 2, they will be vaccinated against 14 preventable diseases. And if your child has missed a vaccine at this point, now would be a good time to catch up on any missed immunizations. Between the ages of 4 to 6, children should receive the following immunizations: DTaP, IPV, MMR, and varicella. These will be the last doses of these vaccines. During this time, your children should be up to date on their immunizations if you're seeing your primary care physician regularly. If your child has missed a dose, now is a great time to get your immunizations up to date. Between the ages of 11 and 12, children should receive the following immunizations. Tdap protects against diphtheria, tetanus, and whooping cough. MCV, meningococcal conjugate vaccine. HPV, 3 doses, human papillomavirus. At age 16, your child should receive their second dose of the meningococcal vaccine, MCV. Also, if they have not started their series for the HPV vaccine, now is a good time to start that as well. Before your child heads off to college, be sure to check that their vaccinations are up to date. A booster shot is an additional dose of a vaccine that is used to boost our body's immunity. For an example, a tetanus shot is administered to adults every 10 years. One of the most important relationships you can have is with your child's primary care provider. Make sure to bring your child in annually so we can make sure your child is protected.